I'm going to go over what happens in a normal breath cycle. So picture your diaphragm, which is a dome-shaped muscle that sits underneath your rib cage. Picture your pelvic floor, which is a hammock of a bunch of muscles that sits in your lower pelvis. Think of them as two opposing bowls stacked on top of each other. Take a breath. We're going to inhale, and our diaphragm descends, flattens, pushes down into like our guts, and then the pelvic floor eccentrically lengthens to accommodate that change in pressure. And then the exhale, the opposite happens. So we inhale, diaphragm goes down, pelvic floor lengthens, exhale, the reverse happens. So this happens with each breath. When we inhale, we actually want our pelvic floor to be eccentrically lengthening and not tight and on. A lot of times in postpartum, or if there's any symptoms of incontinence, or even any athlete that has pelvic floor dysfunction, sometimes the pelvic floor is always on and very tight. We don't always feel that it's on, but it's a subconscious sort of low-grade contraction. And so learning how to inhale and lengthen those tissues is really important, because every muscle needs to lengthen and contract, just like your bicep. But if you're always in a contraction and then you go to ask it to do something, it might not have the strength and it kind of can give out. So like if you have ever leaked with coughing or jumping, you might not be weak, you might be tight in your pelvic floor. And those are things that a pelvic floor physiotherapist can assess on you and help you figure out, because it's sort of a misconception. A lot of times people think we're weak and we need to do a lot of pelvic floor exercises, but that will actually make things worse if you're always tight. So learning the proper breath cycle, our inhale is a lengthening and a relaxing almost, and then an exhale is just a lift, not a squeeze. That's different. That's actively squeezing and doing a core brace. That doesn't need to happen on just a normal breath. So I hope that makes sense. Inhale is expansion, lengthening, rib cage expands 360 degrees. Exhale, the opposite happens. Try that and I hope it helps.